Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Cory is a 23-year-old male recently incarcerated in the county correctional facility for a 9-month sentence following his third conviction for battery. As part of an early release program, he is required to participate in therapy. During his initial interview, he is very pleasant and engaged, expressing no anxiety or distress with his current circumstances. His psychiatric history is significant for numerous adolescent episodes of running away, truancy, and substance abuse. As a young adult, he reportedly has not held a steady job, but rather is constantly coming up with money-making schemes that typically take advantage of someone vulnerable or unsuspecting. Given the likely diagnosis, evidence-based practice suggests that Cory may A. have a family history of the same disorder, B. respond well to dialectical behavioral therapy, C. have impaired emotional defense mechanisms, or D. come from a small nuclear family. And so, A is the correct answer because Cory's history and current findings are most consistent with antisocial personality disorder. Antisocial personality disorder is 5 times more common in first-degree relatives of men with this disorder as compared to controls. Whether it's nature or nurture, whether it's genetic or environment, or probably both, we really haven't seen evidence to tease out which one is more compelling, but it is clear that antisocial personality disorder is 5 times more common in first-degree relatives of men with this disorder as compared to controls. So there is clearly either a genetic, environmental, or combination predisposition or etiology. Dialectical behavioral therapy, choice B, is used to treat borderline personality disorder, and while it is becoming more and more utilized with different personality disorders, it certainly wouldn't be the best answer here for antisocial personality disorder. Antisocial personality disorder is actually exceedingly difficult to treat. It requires a very structured boundary-setting therapeutic interaction, but cognitive behavioral therapy is really the foundation of antisocial personality disorder. So while dialectical behavioral therapy may be an alternative, A is still the best answer to the question thus far. Now, C says have impaired emotional defense mechanisms, and patients with personality disorders actually tend to have heightened defense mechanisms. This is what's responsible for their symptoms and behaviors, and the inability to penetrate those defenses present a challenge to successful therapy. And then finally, D is incorrect, as boys with antisocial personality disorder actually tend to come from larger nuclear families. And so, given the history going back into adolescence, this is a classic analysis and application question. You're not given a diagnosis here. You have to take all of this information and evaluate it. And if you do, hopefully you come up with a likely diagnosis of antisocial personality disorder. I recognize that for a formal diagnosis, we have to evaluate the patient for full diagnostic criteria, and those are not presented here. Further evaluation is needed, but the question says, given the likely diagnosis and given all the information you have here, the likely diagnosis is antisocial personality disorder, then the best answer to this question is that given the likely diagnosis of antisocial personality, Cory is likely to have a family history with the same disorder, as we have identified 5 times more common in males with first-degree relatives of this disorder.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.